Hi, Dr. Sasse here from Sasse Surgical, and I've done some speaking recently where I was speaking to both medical audiences and to regular folks and patients about what the metabolic effects of metabolic surgery really are. And by that, we mean what are the hormonal effects. So we know that metabolic surgery is weight loss surgery, which is the same as bariatric surgery. And it, in most people's minds, results in losing weight. And losing weight has a bunch of secondary effects like taking some stress off my heart and off my lungs and taking pressure off my knee joints and less strain on my kidneys. And there are a lot of health and medical benefits that come from losing weight. But what a lot of people, including a lot of medical providers, don't really understand is that metabolic surgery has more direct effects that are truly metabolic effects. And by that I mean that there's an instant direct change in some of the underlying biochemistry, that is our underlying hormonal programming that regulates various aspects of our metabolism, our blood sugar, our lipids and cholesterol, our sleep, our blood pressure, and many other things that are going on in the background in terms of these ongoing metabolic or homeostatic functions. It seems weird that some of those would be regulated by hormones that come from our GI tract, but it turns out that Mother Nature made us with a lot of metabolic control centers, and the biggest metabolic organ, or the organ with the greatest amount of hormonal secretion, is actually more like many organs. It's the whole GI tract, where in the stomach and duodenum, pancreas, and intestine, we have a lot of hormonal secretion going on that's regulating those important systems. So over time, metabolic surgery has become more targeted, smaller, safer, simpler, to the point where now it's a 45-minute procedure with 4 Band-Aids and safer than an appendectomy in the United States. But what happens is that there's a direct change in a number of hormones right away. As soon as we remove some of that stomach tissue or bypass some of that stomach and intestinal tissue, there's a direct change in many of the regulatory hormones. Some of them have gotten names. They've been named as a result of research examining metabolic surgery. Others have been known to us for decades, and we're just now understanding how they work. But let me just describe a few of the immediate metabolic effects of the surgery that don't really have anything to do directly with weight loss. So number one on that list would be diabetes and the resolution or reversal of type 2 diabetes. And this happens as a result of those hormonal changes. It happens right away in part, and then it happens more slowly in part. But we see a real change in a number of important hormones, including one that's called GLP-1, which rises significantly after metabolic surgery, and it stays elevated over time. And a number of other hormones, including ghrelin and peptide YY or PYY. And a whole host of others, including leptin and many others that have kind of funny research names. The result of this is that we have much improved insulin sensitivity. That means that insulin works better to help the fuel, the glucose, go into the cells and be utilized, rather than just hanging out outside in the circulation and attaching itself to other proteins in the body and causing harm. So we see that direct metabolic effect right away after surgery, and it's independent of weight loss. But there are many other direct hormonal effects too, which we routinely measure. The most common one that we see here in the clinic on an ongoing basis is improvement in people's lipid or cholesterol profile. And this occurs because of that same family of hormones that changes directly affects the circulating triglyceride level. And so as you measure your, quote, cholesterol, what in fact is happening is that the lab is running 4 tests: the total cholesterol, the LDL cholesterol, the HDL cholesterol, and the triglycerides. Many people think that triglycerides are the most important predictor of cardiovascular disease, atherosclerosis, stroke, and heart attack. And when the triglycerides are very high, this is thought to be very bad. It's a risk factor for all those things. And when they're very low, this is considered a very safe or very low risk lipid panel profile. So one of the most striking and consistent things we see after sleeve gastrectomy or gastric bypass is that triglyceride levels fall, and they often fall dramatically. It's not uncommon for them to fall 25 or 50% after surgery, and to do so fairly early and then to stay low years and decades later. This is again one of those direct hormonal effects. But there are many others. Research has shown that sleep apnea, a problem that we used to think all had to do with excess soft tissues from excess weight gain in the throat and the neck, impairing our sleeping, and so you'd snore a lot more, you'd kind of stop breathing as a result of obstructing the airways. But in fact, there's also a hormonal element, and some of the biochemistry that controls our sleeping and our sleep drive and sleep regulation, once again, gets favorably impacted by the changes in these gut hormones. And so we see in excellent research from the University of Michigan and elsewhere that sleep apnea improves immediately and directly after sleeve gastrectomy and metabolic surgery. The same is true, we believe, for high blood pressure, for renal function probably, and maybe many other things, including brain function itself. So quite interestingly, what we're beginning to understand is that obesity is one feature of a complex environmental problem in which factors in the environment have hijacked our genetic blueprint, our metabolism, and led to dysfunction across all the organ systems. And this strange surgery that surgeons and scientists stumbled across many decades ago seems to be reversing many of those processes by directly impacting the hormones that regulate each of those systems. There's much more to learn, but I hope this adds a little bit of insight into why we see improvements in so many organ systems after this kooky little surgery removing a strip of stomach tissue, and why it really does not have much to do with making the stomach smaller and then eating less and then waiting 6 months till you lose weight. Much of it is a direct hormonal impact on improving those health conditions. All right, I hope that shed a little light on the metabolic effects of metabolic surgery. Dr. Sasse here from Sasse Surgical. I wish you the very best of health.